the president's health care bill will be deemed unconstitutional at the Supreme Court level, and we will be given an opportunity. Not the Supreme Court. We had a win at the 11th Appeals Court this week, which is a step in the right direction. And I think the opinion is growing that that is likely to happen. I mean, you can't, when people can't afford to buy groceries, how can you make them buy insurance? I mean, it's just, I think, deemed unconstitutional. So we'll find out. And what that is going to give us is an opportunity to come back and do this, I think, the right way. And what was kind of the major problem with that whole bill was it didn't address the issue, and that's the cost associated with health care. And so hopefully we'll have another opportunity to do better. We certainly need reforms. What we have in place is not working, and I don't believe this will do any better. In fact, I think it could bankrupt the nation almost single-handedly. Now, with that said, the other opportunity we have is if that doesn't happen in the short run, of course, people at the ballot boxes in November 2012 have an opportunity to change that as well. If you elect people who agree with you on either side of that. The other opportunity we have is at the end of this year with this committee that is working on things to avert the the cut to physicians. And you know, I'm not optimistic, but there is hope that they will take the two things that are the drivers. We need fundamental tax reform to get people back to work. That's the growth opportunity. And we need entitlement reform to save Medicare, primarily Social Security. Because as I said, it's bankrupt. Under the president's plan, this board of 15 bureaucrats, the iPad board, gets to decide whether you get seen at the doctor today or you're not worthy of being seen, or whether you get seen or not. So I think there is some hope that we will take care of the doc fix and some of these major programs and some kind of major big deal. You know, Boehner and the president were trying to come together on a big deal weeks ago, and it just fell apart. We're going to get one more chance to do that, and maybe could avert all of that disaster. But I can't handicap that. I wish I could.
Well, I don't think a lot of people realize that when the Medicare system came in with the inpatient prospective payment system, when they went to a DRG basis, it was never designed to cover the cost that the hospital had for taking care of a patient. So the hospital's always lost money on every Medicare patient. And then you come in and because of OPTA, or the Affordable Care Act, we just took a cut. You know, instead of getting an increase for your cost of living, every year you just take a bigger cut.
Yeah, it's not done the right way. We can do better.
Okay.
I'm the silver-haired legislator for Lynn County, and I'm also on the advisory board with our nutrition center and with the aging council. So my dealings are always, for the majority part, with those of us who are on Social Security. I have one request, and I don't care which party it is, because both parties are being childish, immature, fighting each other. I want to see people come together and look at what's happening to all of us. I'm pretty conservative. I'm not as conservative probably as a lot of people, but I have some pretty basic values that are pretty strict. But I hear all these things of, well, we're not going to do no matter what. Who do you think you are? I didn't send you there to do what you wanted to do. I sent you there to do what's best for us. And when both parties sit down and decide that they're not going to budge 1 inch from what's going on, then to me you're no good to us. Because there has to be compromises all along the way. You know that. Oh, yes, there does. Anybody that grows up and says they never compromised to make something happen, I don't believe them.
Well, I share your frustration. I mean, that's the reality of a divided government. But I will tell you this. I think the body in Washington is very reflective of the American people right now.
But you're up there looking out at us, and we're out here looking at you.
Well, what I'm suggesting to you is the people I represent have made it very clear to me in the town halls that we've done, in the telephone town halls, and the polling data that we have, that they do not want any compromise. We have a very conservative district. Now, I'm not suggesting that it is your view. I'm saying it is the majority view. And what I will tell you is there are districts, Nancy Pelosi's district, that probably feels as strongly on the left as the majority of the people in Kansas feel on the right. And so what we have is we've become a very polarized nation. And then is it any wonder that your representatives are reflective of that when they get in Washington? And I'm told, you know, by my constituency, don't you give an inch, hold firm. Pelosi's constituency are telling her the same thing. And so that's why you see, I think, I don't know that it's ever been this way in history before, but we really are at a crossroads. We need to decide, are we going to go Nancy Pelosi's route, the big government, higher taxes, more government, more spending, or are we finally going to get this done, again, the way I think it should be done? You know, get people back to work, cut the spending, balance the budget, and get our house in order. And we just see things so totally different. It's very difficult. It's hard to explain, but it's just very difficult to find common ground when you see the world through such totally different
Well, how come, where was this attitude 8 years ago?
That's what I'm saying. I think it has bubbled up. I'm not sure I've ever seen a nation this divided. Maybe it's happened over, some of you are a little older than I am, maybe we've been here before, but in my lifetime, I've never seen people on both sides of the spectrum so irate, angry, and unwilling to have a grown-up discussion with somebody who sees the world differently. It's right. Just, and that's the reality.
And can you tell me you've never compromised in a situation in order for the betterment of whatever it was you were doing?
Well, I can tell you, I never compromise my principles. I mean, there are some things you just can't compromise on.
I understand that.
Yeah, but short of that, I'm always willing to have a discussion and to try to do what's best, not only for you all. Sometimes we get real parochial and what is best for the people in the 2nd District and what is best for the nation. But I always try, I mean, there's no one in Washington that can vote for me. No one.
Right. Then why?
I mean, the people I work for are the people in this room and across the 2nd District, and I never forget that. I mean, that's what motivates me, but it's very hard when you have people on the far left, people on the far right. What you try to do is represent the majority view, the majority of the time, without compromising your core principles.
But I don't understand why they are having such a terrible time knowing the basic things that people need. Just for instance, Medicaid. All of us look at that as welfare. I mean, that's the way we were brought up. But our elderly people, when they get ready to go in a nursing home, they have to shed any assets that they have in order to get some help. If I go in and I only have so much money of Social Security to pay, I better not have any assets because those have to be gotten. You have to do away with them so Medicaid can come in and help. And they shift all their money out and give it away, where if we could help them some, then they wouldn't have to do away with all their assets and maybe not have to have as much help, but they're not flat broke either. And then the Medicaid amount would not be so, because we're forcing them to do this. We're forcing them to get rid of anything they have. And it's just like our care for our elderly. We are forcing these people into nursing homes with Medicaid after they've divulged all their assets, got rid of all of them. because all the programs that benefit the elderly for home care, they keep cutting. The federal cuts theirs, when the Fed cuts, then the state cuts. We can keep a person in their home for $1,500 a month. We can't keep them in a nursing home for that. And the state has to make, and little old ladies like me, we've had jobs that didn't make a lot of money. Back in our day, there wasn't a lot of corporate women that made big amount of money. So they're probably on, say, $700, $800 a month Social Security. Well, the federal, with Medicaid, has to come in and pay the difference for that elderly person being taken care of in the nursing home. Makes Medicaid go up when they can support in-home care and save themselves so much money. But the feds won't do it. They just keep cutting at it, keep cutting at it, and keep cutting it.
You make some great points, and I'm living this. My dad's an amputee with Alzheimer's, and my poor mama, is just at her wit's end right now. We don't really know what to do with Daddy. On the farm, just trying to get through the days.
Want your mother to go broke?
Well, it will, and that's, we've been to see the attorney. Yeah, you go, wow, could this be any more complicated and any more, confusing for the American people? But what I will tell you is one of the things in our budget was to take a look at Medicare, because we are fearful that there is some waste, some fraud, some abuse of the system, and we are not equipped at the federal government to handle it. Just they do a lousy job, and so the approach that has been widely I think well received, even certainly in the state of Kansas and other state governors. I think we even have a Democrat governor that is going to probably come out in favor of this, is to block grant the money that currently comes to the federal government back to the states and let every state figure out how best to address their citizens' needs with the funds. And we think they will be able to root out the waste, the fraud, and the abuse, and better meet their citizens' needs. The home care is one that I'm personally championing. I just think if you can keep somebody in their home a lot cheaper, I mean, for me it's just a numbers thing. Why wouldn't you do that? So we've signed on legislation at the federal level to hopefully help with that. But I can tell you, we know there's a problem, and we think that the block granting might be the best approach at this point. I know the headline in the Cap Journal yesterday was, or was that just today? I can't even remember. Collier, a physician, the lieutenant governor, is taking a look at this right now. Hopefully, if the block grant money comes, we can do it right for our citizens, and then let the other states worry about how best to care for their folks. But we're a tough old breed here in Kansas. If we know what the rules are and they're just not so crazy, we'll figure it out and we'll take care of each other. And so there's help, I'm hoping, on the way.
We have time for 3 more questions.
Kind of shifting gears here, I've seen statistics that show we spend $440 million in Kansas on illegal alien benefits. Do you have any idea what we're spending on a national level and how you all up there can help stop this or change it?
I don't think anybody has their hands around the fiscal effect, but we do know there's a financial impact at the federal level, as well as just a national security issue when you don't know who's coming across your border. I mean, given what's happened in our nation in recent years, that is concerning to us. So, again, while Republicans have several bills in the House to address the issue, securing the border, having businesses kind of be that second line of defense to make sure that we're not hiring folks because they're coming here not because we're charming, but because they won't work. If we could stop it there. But again, it's like I said to somebody else, unfortunately the Democrats in the Senate just see it opposite. And so in this kind of environment, I wish I could wave my wand, but it's not happening. We're not going to fix it the right way unless we see some new faces in the Senate and in the White House.
Yeah, my question is in regards to the community development block program funding. As I hope you're aware, there's really no other more important funding source to low to moderate income communities like Pleasanton